Hi, my name is Latoya Scary, and I will be doing a persuasive speech on teenage pregnancy. In the U.S., there was steady decline in teenage pregnancy from 60 out of 1,000 teenagers in 1991 to 40 out of 1,000 teenagers in 2005. Nevertheless, there was an increase up to 42 out of 1,000 teenagers for 2 years consecutively, from 2006 to 2007. The rates fell again to 39.1 out of 1,000 cases in 2009 and further to 34.3 per 100 cases in 2010. Despite of this fall, about 1 million teenage pregnancy cases are still being reported annually in the U.S. An issue of concern is that all of births in the U.S. today, 13% are teenage mothers. More so, there is a chance of up to 0.25 that a teenage mother will have another child in the span of 2 years. Thus, teenage pregnancy is still an issue of concern, and we should rise to address it. In order for us to appreciate that teenage pregnancy should be discouraged by all means, we need to understand the major risks and consequences of teenage pregnancy. There are physical risks for both the mother and child. According to the American Medical Association, babies born to women who do not have regular prenatal care are 4 times more likely to die before the age of 1. Pregnant teens younger than 17 are at risk for poor maternal weight and at a higher maternal mortality rate. The infants have double the risk of low birth weight and prematurity versus infants who are born to women aged 20 and older. Babies of teenage mothers are more likely to die in the first year than babies of women in their 20s and 30s. The risk is highest for babies of mothers under the age of 15. In 2005, 16.4 out of every 1,000 babies of women under the age 15 died, compared to 6.8 per 1,000 for babies of women of all ages. Parenthood is the leading cause of school dropout among teen girls. Teens who have dropped out of school are more likely to become pregnant and have a child than their peers who stay in school. Without education, a teenage mother may lack job skills, making it hard for her to find or keep a job. A teenage mother may become financially dependent on her family or on the public assistance. According to the March of Dimes, teen mothers are more likely to live in poverty than women who delay childbearing, and more than 75% of all unmarried teen mothers go on welfare within 5 years of birth of their first child. According to an article from the health communities, teenage moms are more likely to drop out of school, but only 1/3 of teen mothers attain a high school diploma. Teenage pregnancy also affects the income of the mothers. 2/3 of families begun by a young unmarried mother are poor. A teenage mother is likely to have low annual income. This leads to reliance on welfare at some points, and has been noted this is likely to happen to about 85% of teenage mothers. Poverty is a cause as well as a consequence of early childbearing, and some impoverished young mothers may end up very poorly no matter when their children are born, nevertheless all through disadvantage. Teenage pregnancies are expensive to the individuals and the government. The cost of teenage pregnancies is estimated to be $7 billion annually. This results from lost tax revenue, criminal justice system, child health and foster care, as well as public assistance. Other effects include risk of drug and substance abuse, as well as emotional crisis. Teenage pregnancy has been and still a problem in our society. What can we do to eliminate the problem? We, therefore, need to take actions and to prevent further teenage pregnancies and to promote the current downwards trends that the government has attained. The first step in preventing teenage pregnancy is to practice abstinence, which is the practice of refraining from some or all aspects of sexual activities. Comprehensive sex activities that teaches about abstinence as the best method for avoiding STDs and unattended pregnancy, but also teaches about condoms and contraceptions. Planned Parenthood is the largest provider of comprehensive sex education in our communities. Talk about sex with your kids. Most teenagers trust their parents on the subject of sex and birth control. You are likely to be the first person questions are directed at. If you're going to have sex, make sure you use a condom. They have male and female condoms available. From 2005 through 2010, the CDC funded 9 state teen pregnancy prevention organizations for Title X regional training centers and 3 national teenage pregnancy prevention organizations through the promoting science-based approaches to prevent teen pregnancies. The U.S. government has made significant steps in dealing with the problem of teenage pregnancies. Use of evidence-based intervention programs in sustainable manner and sex education to the teens. There is a need to participate in the implementation of evidence-based and evidence-informed programs. Health experts recommend that teens should be provided with medical and accurate information that is guided by evidence in order to curb teen pregnancy. Secondly, we should participate in stakeholder education on the available strategies to avert teen pregnancy based on evidence, facts, and data. We also have to participate in ensuring that teen pregnancy prevention programs are sustainable as well. Through advocacy for abstinence from sex or constant use of birth control measures, we will be able to participate in reducing teenage pregnancies in our communities. In summary, teenage pregnancy is rampant in the U.S. It has numerous effects and implications for both the mother and the child. However, although statistics in the U.S. indicate that it is declining, there is need to ensure that it is pushed much lower. You and I have a role to play in this issue. I will leave you with a quote. Reducing teen pregnancy and birth is one of the most effective ways of reducing child poverty in the country. Thank you.